Surgeons of Reddit, what has been your biggest oh crap moment? So, I doubt you'll get to read too many real stories. Mine is extremely rare as I was the patient but awake for the surgery. I was supposed to have a bump on my back removed. Nothing huge, just a lump of some kind. For insurance reasons, they did it at an ambulatory, in the OR of a hospital instead of the surgeon's actual office. So I'm wide awake, face down in the OR. I'd picked him as my surgeon because his main practice was plastic surgery. At the time, I lifted weights a lot and spent a lot of time working my back. I wanted as small of a scar as possible. I was vain. Well, he begins with the first incision, then goes for a second, larger one, then goes deeper, I guess, and realizes the bump is just the extruding tip of a cyst cut through my back to the back of my lungs. He wasn't used to operating on alert patients, and as soon as he realizes, he just says, "Oh, F." And that was the beginning of a 4-hour surgery for which I was awake. What they cut out of me was the size of an adult fist. In closing the wound, they drew in so much flesh, for lack of a better word because of my lack of medical understanding, that my right arm essentially became inflexible. I couldn't lift weights for years. All that previous work shot down the drain. What an a-hole I was. Next story. I woke up during the last part of my gallbladder removal. I felt this pressure as my surgeon, had him for a prior operation, funny guy, was trying to close one of the wounds. Well, I lifted my head, we locked eyes, and he had this startled, oh crap look. Then he snapped back to normal, said the patient is up, and the person in charge of putting me under was on that crap. Woke up an hour later in recovery. Next story. This one's from my dad. We were pulling up a central line for a drip with an 18G needle, 1.2 millimeters, relatively big compared to most needles, in the patient's external jugular. And then, all of a sudden, the needle went right into the jugular. We all started panicking because usually with a drip, the needle is meant to come out and only the plastic remains. But now we had lost the needle inside this guy's jugular. Before we could even fish it out, it was gone. I looked at the fellow surgeons and nurses, and before we could do anything, we rushed right into theater. After a few minutes, though, we fished the needle out near his subclavian vein, closer towards the shoulder, and we breathed a sigh of relief. Next story. Craziest, probably a medical student passing out face first into the wound, then falling backwards and cracking his skull on the floor. He starts bleeding from the head and isn't moving, just total silence for a few seconds. We didn't know whether to laugh or yell at him or what, but luckily I didn't have to have that talk with the family. Then my favorite, when I was a student, my chief resident was sleeping with one of my friends who was also a student. We were both operating with the chief of surgery when someone pages the chief during surgery. The nurse looked at it and said it wasn't important. The chief gets annoyed though and asks her what it is, and then she replies it was a text page. "Would you like me to read it?" she says, and then he says yes. Well, it was my friend telling him she wanted to meet him in a call room after he was done. Paraphrasing here, and then another awkward silence. Residents sleeping with students is a no-no, and having them page you in surgery is one too. But the chief of surgery was having an affair with the nurse. We all knew it, so after a rapid-fire exchange of significant glances around the table, we all shut the hell up and finished the case and never spoke of it again. Next story. Way back in the day, pre-op was done with alcohol-based cleaners. Naked, sedated guy with a light sheen of cleaning fluid on him plus static electric sparks equals fully engulfed in flames. Everyone just stood there for a second till someone grabbed a sheet and put out the flames. Surgery went well, no complications, slight suntan. Next story. My first ever C-section was quite the shocker, but after that, not a lot fazed me anymore. This event occurred during one of my internships as a high schooler to see if medicine would be my field. Why, I'm not sure, but they let me attend a C-section. They placed me at the feet of the woman that was numb, chest down. I gave her a little nod and the operation starts. Well, no one had thought to tell me that once the belly is cut, the liquids go out too. This is a logical thing, but I was seated at least 3 meters from the feet of said woman, and the fluids gushing from her abdomen came out all the way to my feet. So here is me, standing in a woman's pregnancy fluids. Oh crap. I must have looked very shocked because the other surgeons had a laugh about my reaction. Ever since though, I have not been shocked once. Next story. I was in charge in the unit the other day, and this happened. We had a patient in the ICU who had some big abdomen trauma. He had gone to the OR and was too sick to be able to close his abdomen, so we left it open. We had a piece of plastic covering, like a bag covering his intestines, and then we placed a vacuumed sponge dressing on top of that, called a wound vac. The patient's nurse called me into the room to look at the abdomen because she thought she saw pieces of the bowel seeping out of the bag and getting sucked against the wound vac. I agreed and thought the bowel looked pretty dusky as well, so we called the doctor to come in and look at it. The resident agreed and talked to his attending, who told him to take the wound vac off, tuck the bowel back into the bag it had escaped from, and put a new wound vac on. It all sounded like it was just going to be a disaster, but whatever. So resident comes in, takes off the wound vac, and the bowels had become very swollen from the fluids, trauma, etc. So when he took the wound vac off, they all slipped out of the patient. The bag had dislodged significantly. We would tuck the bowels in one side, they'd spill out the other. Here, we had this guy in his bed disemboweling, and we simply could not get everything back inside of him, in the bag or anything. Luckily, the drugs we had the patient on kept him very nicely sedated, and we had other drugs to control any problems with his blood pressure, and the guy wasn't overtly bleeding, but it was messy. We really just had to step back and say, well, crap, how do we get this guy's guts back inside of him? And ended up having to call in 6 other people to help tuck things in here and there until he could get back to the OR for them to get everything back into its proper place. Next story. So I have to say, hearing your surgeon say, oh crap, is already not a good thing. I mentioned in a 911 operator video, hearing the operator saying, uh-oh, or that's not good is also not a good thing. But hearing your medical professional team saying, well, crap, how do we get your guts back inside of you? Oh my goodness, that is horrifying to hear. Those drugs must have been strong to keep him calm because I would have been flipping out and crying if I'm going to be honest with you. But anyway, next story. So I wasn't present for this, but I got to deal with the fallout. Client brings his cat, found as a stray, to be spayed. The vet, my boss, preps cat for surgery and begins cutting and can't find the uterus or ovaries. Uh-oh, cat is a male, and poor kitty just had his belly sliced open for no reason whatsoever. The owner was understandably furious. Next story. Had a friend with a swollen area on his lower back where it got to the point where he could barely sit. So he goes to his family doctor. The doc says, yeah, that's a pilonidal cyst. We should probably go ahead and take care of that. So he told my friend to take off his shirt and lay flat on his stomach. So he's laying there and waiting, and the doctor says, you're going to feel a poke, and at this point, expecting a local. Well, first it turns out that the poke was actually a scalpel, not a local. He said it basically felt like someone took a fire-hot poker and drove it into his back. He then hears the doctor exclaim, oh boy, we have a pumper, just as he feels warm blood and pus now pouring out all over his back. The nurse's face was the only thing he could see, which went from a warm smile to what he termed as pure and unadulterated fear. As the doctor is screaming for her to get gauze and towels, the doctor climbed up and laid on his back to apply pressure for about 10 minutes until the bleeding stopped. So yeah, I hope I never get one of those. Next story. When I was in residency, my first solo procedure was a spinal surgery on a 16-year-old kid, a girl. And at the end, after 13 hours, I was closing her up and I accidentally ripped her dural sac, shredded the base of the spine where all of the nerves come together, membrane as thin as tissue. And so it ripped open out of her and the nerves just spilled out of her like angel hair pasta. Spinal fluid flowing out of her and the terror was just so crazy, so real, and I knew I had to deal with it. So I just made a choice. I'd let the fear in, let it take over, let it do its thing, but only for 5 seconds. That's all I was going to give to it. So I started to count. 1, 2, 3, 4, 5. Then it was gone. I went back to work, sewed her up, and she was fine. Next story. Worked in an OR for a couple of years as a biomedical engineer. Sprinted to the room when equipment wasn't working right, or more often the surgeon or anesthesiologist didn't know how to use the equipment. This happens so much, by the way. With about 70 ORs, this was a fun day. 1. A surgical table was malfunctioning going into full Trendelberg. Table tilts to a serious angle, was tilting on its own, and patient was sliding off of the table. The whole surgical team was holding on to the patient as I ran in. The fix was I slammed the controller against the floor a few times. Patient was okay, but blood everywhere. 2. A resident was putting in a trocar and misplaced it. Sliced open the aorta. 12 hours of surgery to repair. She was going in for a simple procedure. 3. Surgical robot froze in a case. Had to reboot, but the arm was grasping a main blood vessel, so we didn't want to reboot for the fear that the arms would rehome and let go of the vessel. Also, we lost video when it froze, so we couldn't just retract the instruments. Lots of people saying, oh crap, oh crap. I'm the one pushing the power switch, so if it tears out someone's organs, they all look at me. And then 4. Brain surgery. Microscope video feed crashed. I was trying different video connections to get the overhead monitors back up, but every time I accidentally hit the scope with my hand, causing vibrations that were pretty magnified while working on the brain. He told me to never mind and to get the F out. This was my first day, so it's okay. But anyway, many more. ORs are a scary place, but fun, and it's an exciting job for sure. Rewarding to save the day while a team of surgeons, nurses, PAs all thanking you profusely. Next story. The medical stuff really becomes a blur. Complications, bad outcomes, crazy patients, I don't know, but after a few years, even the bad stuff just becomes part of the routine. But there was one moment that still sticks with me from training. I was called into a meeting with the program director, which is never a good thing, and I wasn't entirely sure why. He makes some small talk, then starts asking about one of the junior residents who had been on my service. Definitely one of the weaker residents, but hardworking and likable, and I start talking about her performance and her relationship with the other residents, her strengths and weaknesses, etc. Then, after a minute, I came to the horrible realization he wasn't just asking about her, he was gathering ammunition to fire her, and I was a part of the firing squad. I jammed on the brakes and tried to talk her up, though, talking about her work ethic and how well she got along with the nurses and the team, but we both knew it was a done deal before I sat down. I don't know why it bothered me so much, compared to kids who burned to death and the like, but that sudden realization while I was sitting there that someone I kinda liked personally, who had spent most of their adult life struggling in undergrad, medical school, and the lab, who had what I suspected was six-figure debt, was about to get their career destroyed, just stunned me. I don't know if she was going to be an unsafe doctor. I think the fact that we liked her allowed her to slide further than she should have, in retrospect. But of all the terrible things that happened in residency, that's the one I think about most often. Next story. I was a junior doctor working in neurosurgery back in 2008 when one of the senior registrars, I believe the equivalent is chief resident in the USA, told me his most unfortunate moment. In order to have a patient's head stabilized for surgery, he was using a frame that had a set of 3 spikes that held the head in place. Due to the angle he needed to approach from, this required the patient to be face down. As he was placing the head of the anesthesiated patient onto the frame, the head slipped and his eye landed onto the spike, perforating the eyeball. Panicking and thinking that his career was now over, he then, rather bizarrely, started poking at the eyeball trying to work out what was what until the anesthesiast told him to stop. They then called the ophthalmologist who came to tidy up but what was now a completely ruined eye. After the surgery, terrified, he went to explain to the patient what had happened. Understandably fearing the worst anger, distress, and tears, received the response of, "That's okay. I was blind in that eye anyway." Luckiest bastard ever. Okay, first off, I know I said anesthetized wrong or whatever. I just cannot say that word. And second, oh my God, this guy is so lucky. And then as for me, I have something to worry about if I ever have to go under surgery and my head needs to be near spikes. I'm gonna be like, "Doc, do not drop my head, please. My gorgeous eyes cannot be perforated." Anyway, I need them for narrating. Next story. Yeah, this really happened to me when I was in training to be a cardiologist. I was in my second or third heart procedure/catheterization when my senior doctor got sick, ripped off his surgical gown and ran out of the room. The doctor had just yelled, "Oh no!" and left. I had just positioned these catheters with wires into the sleeping patient's heart. They were just hanging out there, pulsating to his heartbeat. Apparently, the doctor had gotten food poisoning and made a run for the bathroom, never to return. So I've never made it to this point in the procedure before, and I'm just wondering where to take it from here. I haven't even been taught how to take them out safely. I'm looking at the vitals and monitors like, man, what do I do now? And of course, they page my senior cardiology fellow in training who is taking a nap and not returning any pages or calls. No other doctors around. Finally, thank God, my tech/assistant who had done these procedures since before I was born gives me a nudge to flush the catheters, which I do to prevent blood clots and death essentially, and after a few minutes, properly removes the catheters and wires. They get treated like crap, but have saved all of the fellows in training and senior doctors many, many times in complicated situations with their knowledge. Next story. Patient here, but I do have a good oh crap surgery story. When I was 18, I was told to get my impacted wisdom teeth removed. I went to a surgeon who informed me that they were pretty much formed and I would be put on general anesthetics, totally asleep, and the teeth would be broken up to be removed. Day of surgery, I go in. Because of how effed up you get on anesthetics, my mother was scheduled to pick me up after a couple of hours. She arrived and was informed that I was still in surgery. After nearly another 2 hours of waiting, she felt like something wasn't right and called up my father. He came in and was likewise informed I was still in surgery. At some point, they finally said they wanted to see me and threatened to call the cops. It was then revealed that my jaw had been broken. Instead of breaking up my wisdom teeth, the surgeon had tried to take them out in one piece. And on the very first tooth, he snapped my mandible. It popped up into the muscles in the back part of my cheek, coming against my two nerves, trigeminal and facial. He wired it shut in panic without consent or an x-ray. And it turns out the reason you take an x-ray is because you need to make sure the bone is set. My bone was not set. Over the course of the next 2 weeks, the bone didn't heal because it wasn't set correctly, and instead, it slowly sawed through my trigeminal nerve, destroying sensation in the lower right half of my face. I looked like a stroke victim because I had very little control over it. It has since gotten better and moves more or less with the rest of my face, but I don't have as much control there as I should, and sometimes I bite it and do a lot of damage since I can't feel it. But anyway, this was probably the most pain I've ever been in my entire life. I took liquid Vicodin, remember, jaw wired shut, every 2 hours, could barely sleep, and needed help with tasks like walking upstairs and going to the bathroom because of the pain of the drugs. It was hell on earth. We eventually found a doctor to fix it, and he had to reset the bone. This was about a 6-hour surgery and a 2-night hospital stay. The bone was so badly out of whack that it needed a plate and several screws installed to stabilize it. My jaw was wired another 10 weeks while that healed, and of course the nerve damage is permanent. You can definitely tell which side was busted, from both the surgery scar and the lopsided smile. The original doctor who broke it refused to admit responsibility or pay any of the damages. Presumably, he was told by malpractice lawyers never to admit effing up. So I sued for that. In the deposition, he said he broke up the tooth, which of course he hadn't. I had the tooth to prove he was lying, after which we settled for the amount of damage, but about 75% of it ended up going to things like lawyer fees. So I still came out behind on all of that. But I have a wicked scar on my neck from the surgery and my other 3 wisdom teeth, 2 of which cut through, yay! So I got that going for me, which is nice. Next story. I was rounding a few months back and a guy gets wheeled into ICU smelling terrible. I walked over and the dude had maybe the most macerated legs I have ever seen. There were things moving on the bed and the suction container was full of bugs. Turns out dude had been weaving on the road, and when the police pulled him over and opened up the doors, bugs fell onto the road. He got taken to the ER, arrested, taken up to the ICU, and very rapidly debrided, then bilateral above knee amputated. He actually made it out of the hospital, but I cannot imagine waking up one day and having no legs. I really wish I knew where he was driving, though. Next story. I broke my wrist once, and the broken bone had to be surgically adjusted so it would grow to be a nice and functioning one again. It appeared to be an easy and uncomplicated procedure, and 2 hours later I woke up with a caster on my arm, being told everything was fine. A couple of weeks later, I returned to the surgeon who performed the surgery to have the cast removed, and as soon as he took it off, he had a confused look on his face. I could see him think, "Oh crap." And he told me perhaps it didn't go exactly as planned. The 2 parts of the bone weren't placed in a straight line during surgery, so after a couple of weeks in a cast, my arm was now really funny looking and crooked. Arm had to be manually broken again and put in a bit more of a straight position. Few weeks and a wicked looking scar later, everything was okay again. Next story. When I was a medic, I worked in the ER one night, and this huge dude, maybe 300 to 350 pounds, came in from a car accident with the paramedics giving him CPR. We got to doing our job when it was decided that we would have to go to the OR as he eventually went acetol, flatlined. I was new and my knowledge was pretty limited at the time, but I believe they were going to massage the guy's heart. I was pretty relieved since we were all taking turns pumping this big-ass man's blood for him and we were beat. Shortly after he left, I was talking to some of the medics/doctors and they said that it would be a great experience for me to watch it in the OR room. So I scrubbed up really quickly and went in to watch in the back, and they were already about to start cutting this guy open. I watched in excitement as they were cutting through everything when suddenly blood burst out of this guy like a pot boiling over. There was more blood than I have ever seen and hopefully will never see again. I don't remember anyone saying, "Oh crap," but I remember everyone getting really quiet. The staff stepped back as the blood flowed out of him, on the table, falling on the floor, and crept until it got a couple of feet away from me. I was like 6 to 8 feet away. Most of them were standing in the lake of blood when it stopped. The surgeon said that it looked like at least 3 liters of blood came out of him. They hadn't seen that much blood come out at once either. It looked like some kind of Japanese horror scene afterwards, and I think I was in shock because I felt so weird and out of place afterwards, watching them sew and clean him back up. Later on, I ended up finding out that upon a closer look to the x-rays, it showed that the poor man's sternum gave way either from his chest hitting the steering wheel, Yeah, he had no seatbelt on, the firefighters, paramedics, or our CPR. The bone had splintered and punctured into his major vessels, aorta, pulmonary vein, artery. So we were pumping blood into his heart sac, essentially, and that was what exploded when they cut him open. So there was little we could do to save this man's life. After that episode, I was never bothered by the sight of massive blood loss since I didn't think you could see any more than that come out of a single person. Next story. Not quite a surgeon, but somewhat medical. I was bisecting someone's leg, deceased, and I did not know that said person had a mental rod through their femur. Proceeded to cut through the bone with a metal saw. Saw sparks fly and my blade broke. Luckily, I was standing off to the side instead of directly behind the blade as it flew backwards and hit the wall. The clothes the person had been wearing were lying underneath the body and caught a spark. I doused it with the water hose before a large flame could start, but still an oh crap moment. Next story. Since I'm guessing there aren't too many surgeons on Reddit during the middle of a Monday, I'll throw in what I have. Surgical nurse here. I was an OR nurse for a very short time in between two jobs in hospital surgical units taking care of post-op PTs. Right now, I'm in a surgical step-down unit, which means really sick post-op PTs who aren't quite sick enough for the ICU but could still start tanking any minute. Now, most of our oh crap moments are pretty boring, like, oh crap, they found more cancer. Oh crap, his oxygen percentage is going down. Oh crap, there's a mucus plug obstructing her airway. Things like that. But in the OR, the worst I saw was some craphead optometrist who thought spending 5 minutes per patient was a good way to do cataract surgeries. Most surgeons spend about 15 to 25 minutes per surgery. At one point, he told me to keep the pre- and post-op eye drops uncapped because he didn't want to have to wait the literal 5 seconds it took me to unscrew the caps after each surgery. The patient's eyes, they all looked mangled and misshapen after the surgery, whereas every other cataract surgery I have ever seen, the PTs looked fine right afterwards. Not really an oh crap moment, but I told my boss after that day that I never wanted to work with that guy again. It was an accident waiting to happen. I heard one of his patients got an infection and lost their eye, but most of them were fine. Still, I wouldn't have let him watch my goldfish for a week-long vacation, let alone come at my eye with a knife. He was a douche nozzle. Alright y'all, so is there such thing as rate my professor, but for surgeons and doctors? I'm like 70% sure that is a thing, but I feel like we should double check and make sure it is before anybody loses an eyeball because, doctors are human too, and sometimes humans suck. Anyway, next story. Okay, so my mom had gone in for surgery. Because the hospital didn't have what they needed, they had to have an essential part for the surgery shipped to them. The day comes for the surgery and my mom is prepped, the OR is prepped, the surgeon took the day off from his practice, and my mom is put under. Well, the part that they needed, a fluid, I believe, arrived and a nurse said, "We never ordered that," and sent the guy away. This is after my mom was under anesthesia. She said when she was being brought out of it, she could see the surgeon losing his crap on these nurses and all of them crying from how bad he was flipping out on them. Rightfully so. Those nurses at that hospital suck. The surgery was moved elsewhere, and that was the last time he worked with that hospital. Next story. Right as I was about to graduate medical school, I had one of the most formative experiences that led to my very new surgical career. I was on call late with a chief resident who was a really pleasurable person to work with. He let me take the lead on minor procedures, helped me find the things that were interesting in the drudge work I was assigned. Really great stuff. Well, this was not one of those enlightened moments, but it fits the question. I was called by this wonderful chief, we'll call him Wiggles, to come to the ED to assess a patient for possible surgery. Amazing, I think. He trusts me enough to have me work up this patient. So off I trot in a fervor of anticipation to the room where my patient awaits. Wiggles is standing there with this crap-eating grin on his face and just says, "The orders are in, but you need to do the pre-op note, and you'll be doing the procedure. Enjoy," and walks off laughing. Interesting, I think, but Wiggles would not rain on my parade. I would have this moment and the attending would recognize me and all would be proud. I walk in and then I quickly realize what I've been assigned. This is a butt pus case. For those of you who haven't had the pleasure, a butt pus case is when you have an abscess filled with the most vile, malodorous, repugnant filth to ever grace the medical profession, and you have to open up the glory of this pocket putridness so that the cavity in which it dwelt can fill in with nice, healthy, non-crap. They most often happen in people who already have trouble fighting infections or have a lot of tissue where they can hide a pocket of poo, i.e. morbid obesity, diabetic smokers. And oh, my friends, this guy was a stinky, sugary smokestack of a whale. He also what has to be a massive amount of pus hanging out just under the skin of his VW Beetle-sized ass. It was an easy workup, and he was a nice guy. He had a sense of humor. Wiggles had told him that stupid med student would be doing the honor of treating him. As I was getting him ready to go, he says, "Just want to warn you, I'm a squirter." This stopped me in my tracks. And I said, What? I respond as my mind races to fill in what he means. Don't worry, bud, you'll figure it out, he replies. Okay, well, writing it now, it's obvious what he meant, but I was stupid and still psyched about doing the procedure, so I just forgot about it and went to the OR to get everything ready. As we got the guy positioned on the table, it occurs to me how truly large this man is. He had to be around 450 pounds, and he had rolls on rolls of fat dripping down his legs. We had to put his legs in stirrups so that we could get to his butt crack and do the procedure. I was positioned in the front row, dead center, staring deeply into this guy's brown eye, while the chief resident and attempting physician held, with both hands, rolls of fat aside so that I could get to the area in need of debridement. I numb up the skin, call for the knife, and stop for a moment. In that second, I realized what he meant about being a squirter. There was no other reasonable explanation, and I can't imagine why I didn't realize it before. But being the only one scrubbed in for the procedure and being seated right there in the Gallagher splash zone of this guy's ass, I had no choice but to proceed. The attending, perhaps sensing my hesitation, looks down at me with a smile that's visible through his surgical mask and says, "Son, we've all been there." Well, probably not there, but it doesn't matter. You're going to do this. As I lean forward and place the blade into the pocket of pus, the big beluga of a patient gives a great heaving snore and then a cough. He shifts what must have been half an inch downright as I pierce the skin, and the increased intra-abdominal pressure, combined with this guy's massively fat thighs, gives the perfect mixture of pressure, and like a finger over the end of a hose, a straight shower of feculent horror blasts forth, covering my surgical gown, my cap, my shoes, and my glasses. I'm speechless. My brain cannot simultaneously process the horror, hilarity, and smell of what had just happened. The other attendants in the room, however, had no trouble, as they'd been expecting that crap from the start. I had back the scalpel to the scrub nurse, the only one to keep her composure, while the attending, chief resident, circulating nurse, nurse assistant, and the 3 other medical students who had been watching from the door all completely lose it. I must have looked like Jackson Pollock work done entirely in crap. I truly wish that I'd had a witty response prepared, or that I'd been badass enough to just keep going as if nothing had happened, but I wasn't. I was destroyed. I couldn't see through my crap-caked goggles. I must have smelled like Pepe Le Pew blasted with bear mace and dragged through a pool of goat vomit, and I was on call the rest of that night. This all happened around 9 to 10 p.m., and I said, can I go change? And the attending, laughing way too hard to make any sense, simply nodded and pointed out of the OR. So I took off the gown and all the crap-covered materials and went to take the longest, hottest shower possible. I put the scrubs in the laundry and promptly told the maintenance crew that they should be burned. The guys laughed until they saw the damage, and the laughter turned to faces of horror. As I understand it, the rest of the procedure was uneventful. When I went back into the call room, the other residents had been told by the med students in attendance what had happened, and I got a standing ovation. By that time, the hilarity of what had happened had way surpassed any embarrassment that I felt. The patient had had the procedure before, and had apparently oozed quite a bit previously, which had grossed out other residents who had been there. That's what they meant by squirter. Wiggles saw fit to tell him what had happened, and the patient looked like he was going to have a heart attack by the time he stopped laughing. All in all, it was an oh crap moment, though it was gross. I wasn't really that disturbed on a deep level. After that, I felt like there was very little that would shake me at the core in terms of crap, piss, blood, pus, bile, etc. It's all just fluid, and I'd been baptized in the absolute worst of it. TLDR, I was the target of a fat man's crap super soaker. Okay, guys, if you want to know what a 10 out of 10 story looks like for your narrator here, this is it. Fun to read, fun to narrate, well written. I was just reading a story yesterday. I don't know if the video's out yet, but we get these stories sometimes where people like to type as if they're telling a really eloquent story and use analogies and metaphors and big words, and it just kind of comes off as pretentious and meandering, and I'm just like, get on with it. This was that, but it was done well, and I didn't roll my eyes once. I loved this story. Maybe not the subject matter, but the way it was told, fantastic. 10 out of 10, no notes. Next story. So, story from my vet. He was in a super rundown barn with a pregnant mare in trouble. She'd been getting up, lying down, and getting up again, but nothing was happening. Horse births are hell on earth, his words, because the foal doesn't turn until minutes before birth is supposed to happen. And if they're in the wrong position, it's nothing there but rigid legs and a sharp little hooves, and good luck getting that repositioned with 1,000 pounds of frightened horse flesh and pain in your arm. So there he is, up at night, up to his elbow in frightened mare. She's not really into what's going on and doesn't want to stand for it. He's not terribly fleet of foot in that position, so it's up to the owner at her head to keep her calm, and that person is doing the best she can. Keep in mind, this barn is in horrible shape, really just a dilapidated health hazard. Well, the mare decided she'd had enough and tried to walk through the owner. I'm guessing there was a stud chain involved, a metal chain that loops around the nose, jaw over the gums, or however you want to attach it so that you have a more persuasive power over the horse, but the owner was shoved off balance and managed to grab a live uncovered wire. And why there was one in a barn, I will never understand, but the result was that current flowed through her to the horse and into my vet. So now the poor guy is elbow deep in a terrified mare, while both of them and the owner are being electrocuted. And he didn't tell us how he got out of that, but the mare was okay, and she delivered a live foal. They named the filly Electra, and that was when I first began to think maybe I didn't want to be a horse vet after all. Next story. Probably not the story you want, but still, my father is a surgeon. Once upon a time, right before he got married, he saved the life of a jeweler. The jeweler talked about these elaborate golden wedding bands he could make. So when my mom and him were about to get married, they didn't have a lot of money. They saved up every penny so that my dad could request these huge, gaudy 18-karat wedding bands. Seriously, the most ugly things I have ever seen in my life. Well, the jeweler made them and gave them one huge discount, allowing them to keep a good majority of the money that they had saved. My dad loved them. Well, fast forward 40 years, the jeweler is definitely deceased at this point. The guy was like 60, and my dad was coming out of the OR. He typically would tie his wedding ring around the waist ties of his scrub. Well, he goes to the bathroom, does his business, goes to flush, and as he's flushing, he's bent over, and the ring spills loose and falls down the toilet. He frantically calls his secretary, who calls the plumber, who informs him that the ring is gone. 40 years he had this ring. The light at the end of the tunnel was my mom gave her ring to my dad and had it expanded for him. Meanwhile, she got a fancy modern platinum ring that's worth more than my college tuition. Next story. This is less oh crap scary and more oh crap. As a medical student, I got to assist in the repair of a vaginal anal fistula, basically a connection between the two that meant the poor patient was leaking crap out of her vagina. Given the nature of the operation, the operating room smelled so horrific. The anesthetist actually had to leave because they were dry heaving so much. Towards the end of the operation, we had to flush out the remains of the colon, and so I flushed saline through whilst the consultant surgeon stood at the end of the table with a bin bag. Once we were done, the surgeon looked at me with a totally defeated look in his eyes, up to his elbows in crap, and said, "I have a really effing glamorous job." So yeah, that is my oh crap moment. Next story. I wasn't the surgeon involved in the case, but a patient had a bump on his leg. After imaging, it looked like it was an abscess collection that needed drainage. The patient was then taken to the OR and the subcutaneous tissue dissected off, and then all of a sudden, blood starts squirting. It turns out the abscess was really a femoral artery aneurysm. Overhead stat call for the vascular surgeon to bail him out. Next story. General surgeon, 5 years experience. Maybe not my biggest, but one of my first oh crap since I'd been set loose upon the world was just realizing that I couldn't be in two places that I desperately needed to be at the same time. There's a certain vulnerability that happens when you're scrubbed in on a case in the OR. You're the captain of this particular ship right now, and you really should have your whole focus dedicated to it and only it. But sometimes you're in there in the middle of the night or on a weekend and your partners are all gone and there's just skeleton crews running the hospital. Your damn pager keeps going off and your phone keeps ringing, and sometimes it's just Nurse X on the floor who thinks her patient really needs an order for Tylenol at 2 a.m., even though the patient is asleep. Sometimes the call is about your patient actively dying. Now, right now. Heart attack, stroke, blood painting the walls of the room. Everyone trying to communicate this to you is in the process of either trying to stop the dyingness or just freaking the F out and begging you to come do something. But you are elbows deep in the viscera of another very ill person. You can't really just drop what you're doing and race upstairs. You have given an equally strong promise to both of these people that you will look after and protect them from harm. And you have to break that promise to one of them. You have to keep sailing that particular ship otherwise both will go down. If you're lucky, there's an ICU team that can swoop in and help, or residents experienced enough to handle things, or a backup partner who can ride to your rescue and B-word and complain about having to help out Junior all night later. Other times, there is literally nothing you can do except tell the nurse, do what you can, I'll be up as soon as I'm done with the operation. Next story. Mine isn't as gruesome as some of these, but I figure I can share. I have several herniated discs, pinched nerves, spinal splendosis, etc., etc. Went in for a major epidural. Most get 1 to 2, but I was getting 6. Basically, they put you under, fit a needle in between your discs, and give you a shot. Well, it might have been due to the fact that I was taking some heavy dosages of narcotics already, but I woke up on the table. It was kind of hazy, but I was definitely aware. I could feel a slightly burning/fuzzy feeling in my back. It felt like butterflies when your leg goes asleep, and there was something scraping near or on your bones, and it's feeling like that. I could see a screen with a live x-ray looking thing. I found out the surgeon watches the screen to guide the needle. And just as I felt like I could maybe raise my head, I came to the realization one of the nurses kept repeating, "He's awake, he's awake." Not too panicky, but definitely like an oh crap. I wanted to tell her to relax, but by then someone walked up to one of the IVs and I was back to sleep. All in all, it was a win though. I threw a B-word of a fit about how good the fruit juice was, so they gave me the whole container. And I tried to fight the nurses trying to dress me because my girlfriend was waiting outside on me. She thought it was cute, so she obliged and brought me to Wendy's per my request. I then ordered over $20 of food, got home, and ate none of it. Good times. Next story. This happened to me while placing an IVC filter, a small metal filter that sits in the inferior vena cava to prevent blood clots from traveling from the legs to the lungs. But anyhow, the procedure basically includes tunneling into the femoral vein and traveling up into the vena cava where you leave the filter in place. In order to confirm your location in the body, you have to use a radiolucent contrast and an X-ray to light up the vena cava since you are basically looking from outside of the body. The scrub tech hands us 100 cc's of contrast and we inject it straight into the vena cava and watch the X-ray while nothing lights up as it's supposed to. Not able to figure out why we couldn't see it, we ask for another 100 cc's of contrast and again shoot it into the vena cava with no luck. At a loss as to what would be going on, we think maybe that the contrast is bad and we drop some blood and look at the syringe under the X-ray before injecting this time. Of course, the syringe does not light up, and while we are trying to get some new contrast in the OR, the patient on the table who is sedated and intubated begins to seize. We finally look over at the scrub tech's table and realize what she has done. And turns out she was drawing up 100 cc's, twice mind you, of lidocaine, a quick-acting anesthetic which is not supposed to be injected directly into the central circulation of the body. Luckily, the patient was not permanently harmed due to this medical error, but I was working with a very senior vascular surgeon at the time, and I've never seen her look the slightest bit fazed by anything she's seen. But when she realized we gave the patient that much lidocaine, she looked like she was about to faint. Next story. I asked my grandfather, a surgeon of 30 plus years, this exact question one time. He told me a story about opening up a patient to fix something serious with his aorta. It's been 10 years since I heard the story, details are a bit hazy. But anyway, he and the other surgeon, who happened to be my mom's godfather, opened the guy up for this dicey operation and found several significant tumors. Like, well crap, this guy is toast tumors. He said that he had never seen so much cancer. They went out to tell the family, went back in, and as they were trying to figure out what to do, the aorta dissected and he bled out while the two of them were shouting and trying to clamp it. He said it was over in seconds. He felt bad, but the guy was facing a pretty painful death anyway. He figured that there was less suffering that way, but secretly, I think he was upset that they couldn't save him. Next story. So here is my oh crap experience. I was pregnant with my third child and my C-section was scheduled for 3 weeks out. My water broke, so it was now an emergency surgery. Being my third, I opted to be awake. It was important to hear my baby's first cry. Anyway, since it was an emergency, the doctor didn't wait for my blood work to come back. So he rushes me in, does an epidural, and starts the surgery. My son was born, they rush him out. I don't hear him cry, so now I'm nervous. And then all of a sudden I hear the doctor say, "Oh crap," and blood starts squirting everywhere. They rush my husband out and put me to sleep. I wake up in the ICU with my baby, who is also in the ICU, and the nurse comes in to give me a blood transfusion. Come to find out that my iron was super low and they had to revive me twice in the OR. My son was a month early with underdeveloped lungs and pneumonia, but today he is a healthy teenager. I ended up having a hysterectomy due to the doctor cutting something he shouldn't have and then not closing me up properly. Next story. Veterinarian here, a little late to the game. First one, working overnight ER as a fourth-year vet student. Dog comes in with major trauma. We hook up the ECG leads using isopropyl alcohol. We have a bottle of water-based lubricant for the leads, but it always walks away from the machine, and there wasn't time to find it. Watching on the screen when the patient goes into ventricular fibrillation, so the supervising resident grabs the paddles, and the good news is we put the fire out. Bad news, the dog didn't make it. And then my second story, fourth-year student again, observing an orthopedic procedure. The surgery resident leans over to see a structure that the operating surgeon is pointing out, and her glasses fall off, right into the wound bed. And the surgeon says, "F this," drops the leg, and storms out of the OR. The resident is blind and crying, and I'm trying to disappear into the scenery. Next story, thoracic surgeon intern checking in. I was still a young intern when this happened, young enough that the senior surgeon wouldn't let me perform the whole surgery, under his supervision of course, but old enough to be allowed to do parts of the procedure. So I was doing, in my mind, a pretty decent job of dissecting a branch of the right pulmonary artery, freeing it from cancerous nodes around it, when suddenly, dark blood pulsing rose. That was like the tide coming up, only way quicker. My brain froze and I said, oh crap, I had perforated the pulmonary artery, a very fragile organ with 2.5 liters of blood per minute in it. Well, my senior was the Zen master that he always is, and he puts his finger on the breach, which stopped the bleeding, and looked at me, winking, and said, "Well, OP, you're in deep crap now, aren't you?" He stitched the pulmonary artery and finished the procedure. While the history isn't as horrifying as others in the thread, it was my first oh holy crap moment. Next story. Late to the party, but I figured why not? I was a patient in a hospital a few weeks ago. I went on the Saturday night and had doctors looking at me all night telling me I had appendicitis. No worries, that's a pretty routine procedure. Surgeon comes in the morning and looks at me, touches my stomach, and is like, "Oh crap, why didn't you get me in earlier? That's a strangulated hernia. We're getting him into surgery right now." A bunch of embarrassed doctors and me are sitting there like, crap, what the balls is a strangulated hernia? Is he going to die? But thankfully, I didn't die. Next story. For laparoscopic surgery, there are many different ways of putting in your first port. One of the common ways is a versus needle, which is a blunt-tipped needle that you basically place blindly into the abdomen to insufflate it. It becomes very hard to use on fatter people because of the layers you have to go through. I once placed the needle and got back through it pulsate bleeding. You were supposed to get nothing. I pulled it out and reinserted it and finally got it appropriately placed. I insufflated the abdomen and placed my port. When I looked around, I found about 500 cc's of fresh blood. Oh crap. I found a needle hole through small bowel mesentery, its blood supply, but no bleeding from there. Okay, I flip it over and reveal a midline retroperitoneal hematoma. The most notable content of the midline retroperitoneum is the aorta. I had stuck a big needle into this patient's aorta. Lucky for me, it seemed to tamponate off and stopped expanding, and I just held pressure and prayed. A CT angiogram afterwards revealed a hematoma in front of the aorta, but not much else. Next story. Not a surgical story, and over 30 years ago, but knew a cardiologist treating someone for psoriasis, a skin condition usually, never treated by a cardiologist. But he was Asian, and the patient was Asian, and probably sought someone that she thought she could trust. Anyway, he prescribes her 3 doses of methotrexate, which is both a medication prescribed for psoriasis in small doses and for leukemia and breast cancer. As you can probably guess, he prescribed 3 doses of the total dose rather than the total dose divided into 3 small doses. Everyone was familiar with doses for cancer treatment, but not for psoriasis. The pharmacist didn't catch it and the nurse didn't catch it. The patient became very ill with myelosuppression and a failing liver. We all understood it was a huge medication error, but the doctor never told the patient and family about what was going on. He related all as inexplicable. The family couldn't understand how someone was dying from a psoriasis treatment. As nurses, we weren't allowed to pass judgment on any medical action or offer an opinion to the family about what was happening. But one quiet evening, we made steady eye contact with the patient's son and simply said, "You need to get a lawyer." Next story. I was doing research on tracheostomies, and I had the good fortune to follow around a surgeon, and he was performing a few. It was the first one that he was doing for the day, and the first one I was to see, so I scrubbed in to observe. It was an interesting experience to see how they prep the patient and make the initial incision. Having performed the majority of the operation, minus the final cut, he wanted to show me a little bit about the anatomy. While using the scalpel as a pointer, he shows me a few areas of interest. Moving on, he starts to point to another area and says, "It is very important that we take great care that we don't cut." Oh crap. He had cut into a major artery. I think it was either the common carotid or the inferior thyroid, but he had to cauterize the wound and stop the flow of blood. I quickly left the operating room after that, and we never spoke of it again. Next story. A good friend of mine is a dentist. He likes to tell me about the time that during a routine wisdom tooth extraction, he pulled a girl's nerve about 4 inches out of her mouth. He said he was pulling pieces of her tooth out. They had to break the tooth to extract it, and chatting with the assistant when he realized he had pulled out a piece of tooth that had a nerve attached 4 or 5 inches out. He immediately freaked out. In his words, I thought, "Oh man, I paralyzed her." But instead of screaming, he simply said whoopsies to the assistant and proceeded to try to jam the nerve back into the girl's head. The doc was scared, but the assistant didn't even know anything out of the norm had happened. When they woke up, the girl said she was fine, and doc hasn't done a wisdom extraction since. I just want to point out that's 2 botched tooth-breaking surgeries that we have heard about, so, dentist, we're gonna have a video about you guys next because something's going on over there. Not really, but, it'd be interesting to hear about. Anyway, next story. So, not a surgeon, but I get a lot of operations, as I am a congenital heart defect patient with something called truncus arteriosus. So, here's a few stories. Loma Linda Hospital in SoCal. I was getting stents put in my pulmonary artery. I can remember waking up still on the table to Hotel California by the Eagles playing in the background. Well, the table then lurched forward as I hear, "Oh crap!" Then I woke up hours later in recovery. Fun fact, this was the day of the Nisqually earthquake in Seattle, where I used to live. Then, my other story, many years later, I had moved back to Seattle. Age 15, Seattle Children's Hospital. Needed an operation to remove previously mentioned stents, as well as a replacement for a conduit that acts as my aorta. Was scheduled for a 4-hour procedure, and I guess while they were removing the stents, they nicked my aorta. F, man. So while repairing the aorta, they then nicked my pulmonary artery. Double F. The 4-hour procedure ended up being 16 hours long. TLDR, doctors not only effed up once, but twice in my open heart surgery. All right, fellow viewers, first off, I just want to give a shout out to the aorta and pulmonary artery. They got nicked, mentioned, bruised, scraped, and punched so many times throughout this video, apparently, so I guess they're just victims of surgery. And punctured, too, we can't forget that word. But, as I mentioned earlier, these are people, and sometimes people mess up, or they just suck and they're horrible people. But, when they make a mistake, it's your life, so that's fun. But then we also read that story earlier about the robot going out. And I'm going to be honest, I'm going to take the human over the robot almost every single time. You're telling me the Wi-Fi goes out and my surgery stops? Like, what? Excuse me? No. Maybe in 100 years I'll let R2-D2 dissect me. But until then, I'm good. I'm sticking with flesh. And I hate AI. Anyway, guys, thank you all so much for watching, commenting. Have a really good day. And bye-bye.